Constipation is the inability to move your bowels appropriately and empty yourself. Usually what you look at is the frequency of the bowel movement or the lack of frequency, and the biggest picture is how hard it is for that kid to have the bowel movement. Are there diseases that have constipation, diarrhea issues? Sure, but for most kids, constipation has a specific cause. In babies, it may be that it's the formula, or, in a lot of kids, breastfed babies tend not to be constipated. Sometimes switching them to soy works really well. The things that I say to try first is do the little bicycling. You bend their legs up and, bicycle their legs, and sometimes that movement helps to expel the stool, that they don't have basically the real good abdominal muscles to actually get out. The other thing you can do is stimulate the rectum with a little thermometer, like doing a rectal temp will sometimes stimulate the movement and keep it moving. And then, when you start looking at older kids, generally speaking, school-age kids should go 2 to 3 times a week. Now, does that say that if they go less than 3 times, they're constipated? Not necessarily. Everybody's different. Generally, you look at their diet is the first thing I say. It is almost always a kid that's not drinking enough water or doesn't eat their vegetables. So, it's that fiber content. And the things that I look at to encourage first is, add fruit juice and obviously your fruits and vegetables. You want to make sure they're eating at least 3 servings of vegetables a day. The last thing I do is add medication. So you start doing those things, and sometimes I'll do medication to get them jump-started and then get them into a routine. I think the biggest thing is getting kids into a toileting routine. Anywhere I go, I see patients of mine, and it never ceases to amaze me that they come up to me and talk, and they want to just interact. And I actually had one parent that said that he was just kind of pleased to see me outside of the hospital or the clinic environment. Sadler puts the health of our community at the center of everything we do.